Hello, good afternoon. I'm Henry Enriquez. I'm from Caracas, Venezuela. I'm very glad to stay here with you and to share this moment from our presentation from United for the Water Quality. It means on behalf of our partners in our presentation, we're going to talk about every that counts, which is access to clean water, challenges for governances in the framework of peace and development. This is a work for a lot of people who are working in this wonderful project. We have the four non-profit organizations who have worked about the governances and development about drinking water, which is very important for the central region of Venezuela. It means three states, which are Aragua, Carbobo, and Cojedes states. In these places, we have very deep problems with drinking water. People need health solutions and have water, which means give them the possibility to have healthy quality of life, which is a very deep problem that our organizations, which means Gente de Soluciones, Consorcio de Desarrollo y Justicia, la Fundación Universidad de Carabobo y Liderazgo y Visión, have been working to get results for people. It is mean that we have been working in some instruction. Our agenda about this presentation is in 3 points. Drinking water, challenges for governance in the framework of peace and development. Second one is Venezuela, access to water in the context of COVID-19 agenda perspectives. And 3, United for Water Quality. That peace is composed to all those solutions that help minimize conflicts between countries and our societies. We can contemplate the water as an instrument of peace or as potential weapon of conflict. Water scarcity exacerbates tensions. Experts say water will be one of the major sources of conflict in the 21st century. Access to water and the resolution of conflict are closely intertwined. Every living being and every local economy depends on water. So mismanagement can have dramatic health consequences in local economies and the environment, and obviously in public health. As United for Water Quality, we believe we can change our water management for the better. We are more determined than ever that the practices of the past are left behind. Our work to build which is aimed to build a new governance of water in our country. It is by network governance models which has allowed us to realize that in managing water, we must consider each and every of impacts at all levels and include all the stakeholders for consultations and decisions. In one of the regional dialogue tables that we held in the state of Carabobo in last October, participants discussed and reflected on the role of each actor in the platform. One of them expressed that the problem in the state of Carabobo was an engineering issue or an engineering topic, and that all this discussion is a responsibility of the engineers and the public officials, who already have several proposals for the solutions. Another participant answered that it's not an engineer issue. It is a problem multidimensional. It is a matter of public health, political will, and public policies. It's also a topic of education to promote ecological awareness. It is an economic, food security, and human rights issues, among many others, more where we are all part of that. To give an idea of the context in which this dialogue took place, Venezuela is a country which is going through a great political crisis and high polarization. We're talking about issue of the environment, conflicts, and the water situation is politically sensitive. For that, we can sit in the same dialogue table and bring this wonderful project. It is about how people need to work not only from non-profit organizations, it is about how work with people. And this is how we have been working from our four organizations. This is the way that we have tried to to in any case, be one of the most relevant issues for a significant part of humanity in the coming decades. Among the challenges for governance in the framework of peace and development, we have at least 220 million people in the region lack access to safe, potentially more than 480 million people without access to self-sanitations, according to the IDB. 2.2 billion people worldwide do not have safely managed drinking water services. 4.2 billion people do not have safely managed sanitation services, and 3 billion people lack basic facility, WHO. 1 in 3 people worldwide do not have access to safe drinking water, UNICEF and WHO. And more than half the world does not have access. In this context, we have some facts, and these facts are need to be working from our community, and we have working in Venezuela access to water in the context of the COVID-19 with a gender perspective. Constant hand washing, personal hygiene, washing when they get home, among others. Depend directly of the access and quality of water that citizens have to comply with these prevention measures. The constant failures of the supply of drinking water in the central region of Venezuela make it difficult to the citizens to comply with prevention protocols and protect themselves against the risk. On the other hand, the lack of drinking water, which is now water, and the population which is now confined and without water, which is translating to the degradation of the quality for life and dignity of people. The deficit in water supply and quality has been spreading through the country for several years. However, its consequences now intensified even more with the arrival of the pandemic to the country. Over the water, disobedience on the national quarantine decree. Among these consequences, we can mention several focused conflict protests that have been raised in several areas of the country, demanding the re-establishment of water, protests that are taking place in disobedience of a national quarantine decree by COVID-19. These protests can be attributed not only to the deficit in the supply of the vital liquid, but also to the fact that the national government maintains a policy of information. So citizens do not have relevant and timely information on water issues. Resource management is not transparent, and agencies are not accountable for their management. Non-compliance of the Venezuelan state with the normative criteria of the human right to water. The normative criteria of the human right to water are sufficient, healthy, acceptable, physically accessible, and affordable water for personal use, and are international standards established by United Nations Program Development, on which the human right to water is based. For all the above reasons, we can perceive that there is a failure on the part of the Venezuelan state to comply, which is legal obligation regarding for the right to water. Affordability of water and purchasing power in Venezuela. The lack of access to and poor quality of water generate high costs for Venezuelan families due to the need to obtain water from other sources of supply, buying packaged water, tanker truck for building supplies, well drilling, and even container holding. Costs that can reach 40% of income monthly for a family. This failed to meet the normative criteria of affordability, which establishes that the expenditures should not exceed 3% of the family income. Water is a necessary and irreplaceable resource for life. Therefore, access to water is a prerequisite for the enjoyment of the right to health, life, work, and education, dignified standard of living. In the framework of the COVID-19 pandemic, we must think about the quality of life and dignity of people in Venezuela who are facing confinement without water. And this is a deep problem because we have a people confinement and people that have current water and their access to proper water. Finally, gender mainstreaming is required in all our actions. According to the United Nations, women and girls are responsible for water collections percent of households without access to water. The responsibility for water collections unpaid job to the balance the gap between men and women. Evidence of this here can observe from the press that have documents related to access to water in Venezuela, disregarding the order of confinement issued by the national executive. United for Water Quality is possible thanks to the effort and the will of the team. This is an initiative of some civil associations like Gente de Soluciones, el Consorcio de Desarrollo y Justicia, Liderazgo y Visión, y la Fundación Universidad de Carbobo.